Hi everyone. This video is designed for those who might be experiencing some low back pain. We'll first talk about the pelvis, which is associated with the low back and its positioning that can contribute to pain in your lower back. So when we think of our pelvis, these wing bones coming together, they're called the ilium, and creates this basin, like almost this round bowl here. And pretend it was filled with water, and if we were trying to pour the water out of the front of the bowl, we would have to arch our back, right? So the water would pour out the front, the anterior side of the body. That's called an anterior tilt, this arching in your back. If we wanted to pour out the back side, that would be the posterior tilt, when it's pouring out the posterior side of the body. The water's pouring out this back side. So we want to be somewhere in between the two extremes there, but a lot of us can have that excessive arching or even rounding in the low back. So we want to focus on that neutrality of keeping that bowl of water nice and steady and level. So let's get on our backs to start with a breathing exercise first. So join me on your mat, and you'll just need a strap for this today, so grab a strap. And meet me on your mat, on your back, with the knees touching and the feet wide. This is called constructive rest, which is super mellow for your low back and restful for those muscles that might be overworking to protect you. So you might notice even when you lay on your back, if you have too much of an arch here or too much rounding going on. I feel like I'm arching a little bit here, so I'm gonna bring my pelvis a little bit in that posterior tilt, flattening the back toward the ground, just a touch. And then one hand to the low belly, and then one hand up to your heart. And take some nice, smooth, deep breaths here, inhaling and exhaling, just getting ready for this short practice. Some simple moves that are gonna alleviate some pain in your low back. But one of the best tools to help release that tension in the muscles is your breath. And starting together, we'll inhale for 4 counts. And then exhale for 4 counts. And then we're gonna keep going, but we'll start moving with the breath here with it's called 4-part breath, or the box breath. So you inhale for 4, pause for 4, and then exhale for 4, pause for 4. So everything is in the cycles of 4. And if you've been practicing this for a while, feel free to move to 5 counts or even 6 or beyond. Let's start with 4. Inhaling, breathing into that lower hand. Pause for 4. Exhale, 2, 3, 4. Pause the exhale. Inhale, 2, 3, 4. Pause. 2, 3, 4. Exhale, 2, 3, 4. Pause. 2, 3, 4. Inhale, 2, 3, 4. Pause. 2, 3, 4. Exhale, 2, 3, 4. And then continue a few more rounds on your own. Good. You just end on your exhale. And then releasing the hands down by your side. Let's separate the knees. Your feet are flat. And bring your hands to the kind of the bony prominence there. the top of the ilium, the ASIS, the anterior superior iliac spine. And notice there, when you tilt your pelvis in that posterior tilt, really flattening the ground, notice what happens there at the points there, and then go ahead the opposite direction, really arch your back in extreme. And of course, if you're in a lot of back pain, you don't want to overdo this here, right? Be gentle with yourself and do a smaller little rock back and forth here. Just rotating the pelvis back and forth here from that posterior tilt to anterior tilt. Right, so really feeling just isolating that movement. Good. Just a couple more. And then hold in neutral here, somewhere between the halfway marks, right? So you're not overarching, you're not completely rounding and over flattening there, although you want to kind of have that connection with your low back into the ground, but you don't want to be totally tilting and clenching your glutes, right? So you want to have that kind of middle ground where the back is flat. And then a simple core move here, not so simple if you really, really focus on the navel toward the spine, the strength in the belly, your hands right there to monitor those ASIS, those points. Lift that right foot up off the ground and then exhale, lower down. This is called marching. And then the left leg lifts up. And I'm keeping my knee bent, and then I'm just coming up a couple inches. And then the right side comes up and down, and then really hold nice and strong, left up. Now the key here, it might feel really easy, but notice that what side is dipping down. Hold the ASIS really stable and still. It's like you really have to work. I have to really, really focus to get that left side up without it really sinking and dipping down, because my left side and obliques and my abdominals are weaker. So like I said, it seems simple, but not so much, right? You should be feeling your belly, really working here. You might notice one side a little stronger than the other as well, right? Keep that concentration there, just another couple. This is really good for the education of your core, right? A lot of back pain comes from us overusing our back muscles because our core is weak. So we need the support of the front side, this anterior side of the body, the core muscles, to support the low back, to support the spine, right? So it's not all of just our lumbar muscles working to hold us. Really focus there. Couple more, couple more. I'm not counting. It's really about efficiency to me. That's what matters most, the quality, right? Not the quantity. Right? So you can really be taking your time here. Good, and then just rest. Take a nice deep breath in and a big breath out. And if you don't feel like you connected with that move, you're probably not alone. I know you're not alone. So it takes a lot of focus and concentration. And usually I have to be there with someone and tapping on them and reminding them how those muscles are firing. So to hold you steady. So don't be hard on yourself. Really focus on bringing the navel toward the spine is really key. Knitting the ribs in here too, and then also making sure that you're not wobbling side to side in the pelvis. So let's move into a hamstring stretch with a strap. One of my all-time favorites. Kind of loop it around your right foot to start. And if your back is really, really tender right now, you can keep this left knee bent or have it out straight if you're okay with that. You want to keep that posterior tilt here, a little bit of emphasis with the low back on the ground. Bend the knee as much as you need to so that you feel a good stretch either in the hamstring or the calf. Right? And then start to gently bring the leg toward you. And I feel this one a lot in my calf. So you might even bring your foot up, in standing, your foot up against a chair to really isolate in the hamstring. The two key muscles when it comes to low back pain, when I'm treating someone, is to stretch out their hamstrings and stretch out their quads and the hip flexors. Those are really like the two key players, and those muscles attach to your pelvis. So it makes sense because they will help you know, the mobility of the pelvis, which what's right on top of it? The low back, right? So, and the lumbar spine. So it really sets up that foundation for the spine to be in its proper alignment. So a hamstring stretch, key. Quad stretch, key. Third key, that core strengthening. And then your ticket to really get out of pain, if you're feeling pain, is your breath, right? And focusing in on that four part, by the way, I switched. So switch your sides here, loop the strap on the left foot, and maybe even bend the knee, and then gently bring the leg toward you. Finding where you have your hamstring stretch. Bending the knee, especially if you have tension just behind the knee. We don't want those tendons to overstretch. And we also don't want to have a stretch up at the sitting bone. So bend the knee as much as you need to, or back out of it so that you can find where like the meaty part of the hamstring is stretching, and just pull the leg toward you. Take some nice smooth breaths here. Right? Access your breath. Nice, smooth, powerful breaths, steady breaths. And then we'll just release a little bit there. And place the strap to the side. And then when I teach people to log roll, if they are in a lot of pain, so you can roll to your side, like one unit, and then press using that upper hand to come on up to have a seat. So that's getting in and out of bed as well. And then let's come over to a lunge stretch. So bringing that right foot forward. If you needed some blocks, you could have some blocks here, or holding on to like the edge of the counter or shelf. And to begin, let's come a little bit out of the lunge here. Just back it up a tiny bit. And find that posterior tilt here, right? So this is that one where we want the water to spill out the back. So find that posterior tilt that's lifting up on the pit of the abdomen. So there's a little like core engagement here too. And then start to lean forward without arching your back. I could go here all day long when I'm arching my back with no stretch in the front. So let's back out of it. Tilt the tailbone in that posterior tilt. Keep that. Now shift into it. Tell me what you feel there. A little bit more of that quad and hip flexor stretch, right? Big difference. And it's always nice to have something underneath your knee, like a little pad, a little pillow, a blanket, something, a little cushion is nice. You can always flip up the side of the mat too, because it could be a little bit aggressive on this ground. And then, I mean, it's at least a minute hold, right? Really get in there, let it open up, and let's switch around to the other side. Find the posterior tilt here, tailbone down, and then start to lean into it. Like that core and contraction is holding you there too, right? So you don't just lean into it here. I mean, it may look kind of pretty, but go ahead and back out of it and tilt down and come forward. Yeah, I really feel that. Keep your heart lifted, nice smooth breaths here, especially in the intensity when you really feel it. And then your breath is going to tell you if you've gone too far. Your breath just holds and tenses so in your body. So be aware of that too. If you've gone too much, you're probably holding your breath. Great, and then just lean back out of it. Bring the hands down to the ground. If you're feeling okay to do a downward facing dog, step that left foot back, lift the hips up high. Take 2 more full deep breaths here.
And then walk your feet forward. Be really mindful to have a real, like a big bend in the knees, a generous bend in the knees. And then slowly, like push through the feet. The legs are strong. You're slowly coming up to standing. The core is active. And then bring your hands to your heart. Take a full cycle of breath. Good. Exhaling, releasing the hands down. And thank you so much for joining me. Namaste.